Assalam-o-Alaikum everyone, welcome to my YouTube channel, and it's all about Prometric. So let's subscribe and start. MCQs 167 is the term Russian current applies to stimulators which modulates a continuous sine wave. Option C would be the right answer. Yes, option C is correct. MCQs 168 is a painter after a day's strenuous A painter after a day's strenuous work complains of a pain in the shoulder. Most likely diagnosis is bicep tendinosis. Option C would be the right answer. 169 is in neutral standing with the feet pointed outward about 10 degree, patella faces inward, indicates. Option C would be the right answer. Anteversion of femur. MCQs 170 is in neutral standing position the hip joint is weaker anteriorly. Option A would be the right answer because the position and orientation of the femoral head in the acetabulum make it weakest anteriorly. MCQs 171 is a physical therapist has chosen iontophoresis for pain management and decreased inflammation in a patient with lateral epicondylitis. Iontophoresis is an example of which type of electric current? Option B would be the right answer. It is an example of direct current because there is a unidirectional flow of the current. MCQs 172 is person with quadriceps weakness walk with equine gait, correction of which. Option A would be the right answer, correction of which will lose the independent ambulation. So option A would be the right answer. MCQs 173 is complete disappearance of shadow of lesser trochanter in anteroposterior view of X-ray indicates posterior dislocation of the hip. Option C would be the right answer. MCQs 174 is age group of osteogenic sarcoma is 10 to 20. Option B would be the right answer. MCQs 175 is a child is referred to physical therapy with physician order to examine and treat the left knee. During the examination, the patient described diffuse pain throughout the area of the patella and proximal tibia fibula. The mother states that the child has been extremely tired and had a significant reduction in her appetite during the past 2 months. The record shows no evidence of any special testing. All other evaluative findings are inclusive. So, option B would be the right answer. Call the physician to discuss the patient's care. बिकॉज उसको सिर्फ फिजियोथेरेपी की ज़रूरत नहीं है, एक अच्छे फिजिशियन की भी ज़रूरत है. सो यू हैव टू कॉल द फिजिशियन टू डिस्कस द पेशेंट केयर. Okay, so let's come to the MCQs 176. A physical therapist is treating a patient for patellar tendinitis. The patient pain is most aggravated with the activities of playing basketball and running. The therapist has chosen to progress exercises to plyometrics and squats as long as they are pain-free. This is an example of which principle of exercise? So this is option B would be the right answer, specificity of training, because this is very important in every deformity. Okay? So we have to do a specific exercise regarding the patient injury or pain. So let's come to the MCQs 177. What is the insertion side for the levator scapula? Superior angle of the scapula. Option C would be the right answer. MCQs 178 is the law that gives reciprocal relationship between the distance and intensity from the source to surface is inverse square law. Option B would be the right answer. MCQs 179 is flexion of elbow is associated with inferior glide of ulnar and superior glide of radius. Option A would be the right answer. MCQs 180 is a physical therapist has given 6 treatments to a woman with rotator cuff tendinitis. She does not appear to be responding as expected to the intervention techniques. When asked about the other symptoms, she describes a side tremor, weight loss, poor coordination, and unusual swelling in the front of her neck. What underlying pathology may be contributing to her wrist pain and stiffness? Option B would be the right answer. Hyperthyroidism. Hyperthyroidism is characterized by unexplained weight loss, intolerance to heat, tremor, poor balance and coordination, changing moods, and overactive thyroid may be enlarged. MCQs 181 is in the acute stage, ultrasound has a pro-inflammatory effect. Option B would be the right answer. MCQs 182 is which of the statements is false? Option D. HPVC has a single monophasic waveform. This is false statement. Okay. In fact, HPVC can be used for muscle re-education, but it is not a single monophasic waveform. MCQs 183 is teardrop fracture of the cervical spine is caused by hyperflexion. Option A would be the right answer. So, ये थे कुछ important MCQs and stay tuned for more and don't forget to like, comment and subscribe and thank you.